Cancer cases in Meghalaya have reached alarming levels, with the state reporting significantly higher numbers than the national average. Health Minister Ampreen Lyngdoh, citing ICMR data on World Cancer Day, revealed that Meghalaya has 176 cancer cases per 1 lakh population, with East Khasi Hills recording an even higher rate of 227 cases per 1 lakh, compared to the national average of 100. To combat the crisis, the government is focusing on individualized patient care and upgrading treatment facilities.
The ICMR data discloses that we have as many as 176 cancer cases per 1 lakh population. That is big. Whereas in East Khasi Hills, it is also factual that we have registered and recorded 227 cases per 1 lakh population. The average, national average for cancer treatment, detection and others is about 100 per 1 lakh population. So we're way ahead of the national average. This year, it has been decided that we would focus on individual patients